Welcome to the Mercy Lymphedema Program Self-Massage for the Upper Extremity DVD, presented by Sandy Miles and Cindy Harden. This technique is beneficial for women who have active lymphedema and also for those who are at risk of developing lymphedema and want to be proactive in preventing the development of swelling in their affected arm. This massage technique, performed regularly, will help to optimize the function of your lymphatic system and help to develop collateral drainage pathways for the fluid that might otherwise become trapped in your tissues, causing swelling on the affected side. For demonstration purposes, we will be performing the massage on the left side of the body and the left arm. For those whose right side is affected, this process will need to be reversed. This DVD is used along with the self-massage for the upper extremity lymphedema handout provided by your therapist. When done at home, the massage should be done on bare skin, not over clothing. The first step in the sequence is an abdominal breathing exercise. This exercise is a little jump start for your deep abdominal lymphatics and helps prepare the system to handle the fluid you will be mobilizing with the massage. The most difficult part of this exercise is becoming comfortable with the actual abdominal breathing. So let's practice this part alone before incorporating it into the exercise. Place your hands on your stomach and inhale deeply through your nose. As you breathe in, your abdomen should expand, pushing your hands out. Then exhale strongly, at the same time pushing in on your stomach with both of your hands. Practice this a couple of more times. Take a deep breath into your abdomen. Your stomach should expand, pushing your hands out. Then blow the air out strongly while pushing in with your hands. And again, breathe in, then blow out hard, pushing in with your hands. This often takes some practice, and you may need to stop the DVD and practice this abdominal breathing technique before incorporating it into the exercise. If you have back problems, perform this exercise just as demonstrated. If you're able, it's most effective if you combine this breathing exercise with a strong abdominal muscle contraction as follows. Lie on your back on the floor or bed and bend your knees so your feet are flat on the supporting surface. Place your hands on your thighs and breathe in deeply through your nose so your stomach expands. Then, as you blow out forcefully, do a mini sit-up, sliding your hands up towards your knees. This combines a forceful exhalation with contraction of your stomach muscles. Return to the starting position and repeat this exercise 2 more times. Breathe in, pushing your stomach out, then exhale while doing the mini sit-up. And again, breathe in, then blow out while contracting your stomach muscles. This exercise is repeated a total of 3 times. Now we're ready to proceed with the actual massage sequence. It's easier to remember if you think of it as 3 separate lymphatic pathways: the chest, the trunk, and the affected arm. Before and after each pathway, you will clear your lymph nodes in your neck, armpits, and groin. We begin by clearing the lymph nodes in the neck. This is step 2 on your handout. They're located just behind the collarbone. Feel for the hollow spot just above the collarbone. Cross your hands and use your index and middle fingers. Stroke 10 times down and towards the breastbone. Imagine you're directing fluid under the collarbone. If you have a port in place, you may need to do this on only one side, as you don't want to massage over the line running to your port. Then we'll clear the lymph nodes in both armpits. This is step 3 on your handout. Do the involved side first, in this case the left side, and then the unaffected side. Massage deep into the armpit, moving from the armpit towards the trunk. 10 times on the affected side. Then 10 times on the unaffected side. You may want to raise your arm or support it against the wall to better get up into the armpit. Once you've cleared the nodes in your neck and armpits, we begin the first massage pathway. Remember, the whole massage sequence is made of 3 separate sections or drainage pathways. The first pathway promotes drainage from your affected arm towards the lymph nodes on the unaffected side. This corresponds to steps 4, 5, and 6 on your handout. Begin by stroking across your upper chest just below the level of the collarbone, moving from the affected side to the unaffected side in a series of short strokes. Keep your entire hand flat on your chest as you do this, using the palm of your hand and your fingers, not just your fingertips. About halfway across, it's easiest to switch hands. Notice that you start out with a pulling motion, and when you switch hands, you're doing a pushing motion. Remember, you're directing fluid from your affected side to the unaffected armpit. Repeat this step 5 times. Step 5 on your handout is the same as what you just performed, except you move your hands down slightly on your chest, massaging from the affected armpit towards the armpit on the unaffected side. This is repeated 5 times as well. Step 6 is the same as steps 4 and 5, but you again move your hand position slightly lower on your chest, massaging directly over the breasts. If you have significant scar tissue in this area, it would be beneficial to spend a little more time massaging across the scar tissue, as it's difficult for fluid to move across scar. Throughout the massage sequence, the number of repetitions given are guidelines only. It is always beneficial to spend a little more time on areas where fluid tends to pool or where scar tissue is present. Obviously, this varies from person to person. This completes the first of the 3 drainage pathways. Repeat steps 2 and 3, clearing the lymph nodes in your neck and both armpits. However, you now only need to do this 2 to 3 times at each site. The second pathway drains fluid from the armpit on the affected side down to the groin nodes on the same side. This pathway is especially effective if you have any pooling of fluid in the armpit or upper chest region on your affected side. We begin and end this section by clearing the lymph nodes in the groin on the affected side. This can be done laying down or in standing, but you can't reach your groin nodes while sitting. This is step 7 on your handout. Your groin nodes are located where your leg attaches to your torso, or just deep to the panty line. Place both hands, one on top of the other, just below the panty line, and stroke in an upward motion across the panty line toward the belly button in a scooping motion. Begin closer to midline and work your way out. Repeat this 10 times. Now stroke the abdomen on the involved side toward the groin nodes on that side of the body, again in a series of short strokes. Use both hands placed flat on your stomach and along your side. Repeat this 5 times. Next, stroke from around the back of your waist on the involved side towards the nodes in your groin 5 times. If you have trouble reaching around the back of your waist, you can use a towel or a long-handled bath brush, as Cindy is demonstrating. Now we move up to the armpit to bring the fluid down. Stroke the upper and lower areas of the chest, starting at the armpit and working your way down toward the groin nodes in a series of short strokes. Repeat this 5 times. or more if this is a particular area of swelling for you. Again, clear the groin nodes, the nodes in the neck, and the nodes in the armpits 2 to 3 times each. These are steps 7, 2, and 3 on your handout. Now we're ready to begin the third and final drainage pathway, the affected arm. The single most important thing to remember when massaging the arm is that we want to direct the fluid up and around the back of your shoulder toward the nodes in the neck. We do not want to direct fluid to the nodes in the affected armpit, as these have already been compromised by surgery and for some people by radiation. Begin by stroking the back of your involved shoulder up and over towards the nodes in your neck 5 times. If you're unable to reach over to the back of your affected shoulder, you can use a long-handled bath brush. Secure a soft cloth over the head of the bath brush so it will glide smoothly over your skin. Now stroke the outside of the upper arm up to the back of the shoulder toward the nodes in the neck. Repeat this 5 times. The next step, number 16 on the handout, can be confusing. When stroking the inside of the upper arm, or the part closest to your body when sitting normally, you want to encourage the fluid around to the back side of your arm and up over your shoulder, rather than directing it up to the armpit on the same side. This can be done with your arm at your side, massaging either with the palm or the back side of your opposite hand, as Cindy is demonstrating. Or you can raise your affected arm and massage towards the back of the shoulder, whichever is more comfortable for you. Now stroke the front part of the upper arm toward the outside and up over the back of the shoulder toward the neck nodes 5 times. Once you've completed the upper arm, you again clear the lymph nodes in the neck and armpits 2 to 3 times at each site. As we proceed down the arm, there are 2 sets of lymph nodes located near the inside of the elbow. One set just above the elbow bone and one set just below the elbow bone. Using the thumb of your opposite hand, stroke in an upward direction 5 times just above the elbow bone and 5 times just below it. With the palm of your involved arm facing up, stroke all of the surfaces of your forearm in an upward direction toward the elbow. Pay special attention to any areas where fluid tends to pool. For many people, this is at the front part of the wrist, and you may need to spend a little extra time in this area. If you have swelling in your hand, gently stroke the back of your hand toward the wrist, Then massage the fingers gently, working from the nails back toward the hand. Make sure you massage along the sides of each finger, as this is where the lymphatic vessels collect and run. We find it works well to place your thumb and middle finger along the sides of each finger with your index finger over the top, as Cindy is doing. This way you cover all 3 surfaces with each stroke. Once you have worked on each digit, do a general sweeping stroke up the entire arm. Remember to clear the nodes at the inside of your elbow on the way up, and as you get up towards the shoulder, again encourage the fluid around to the back side of the shoulder, up and over toward the nodes in your neck. Finally, remember to clear the lymph nodes in your neck, armpits, and groin 2 to 3 times at each site. You may repeat the breathing exercise from the beginning if you wish, and if time permits, lie and relax with your arm elevated on a pillow for 5 to 10 minutes, occasionally opening and closing your fist. This completes the self-massage for upper extremity lymphedema. We hope it is helpful. Once you become familiar with the massage, it takes about 5 to 10 minutes to perform. Although the strokes are done very lightly, if performed daily, it does help to optimize the function of your lymphatic system and prevent or reduce the severity of upper extremity lymphedema following surgery or radiation treatment for breast cancer. If you have any questions about the massage, please contact your therapist at the Mercy Sports Medicine and Rehab Center.